Okay, thank you. Good morning and welcome to the Homes Committee of Management. It is August 13th, 2024, 11:24. I'll call this meeting to order. First order of business is the approval of the agenda.
Resolved that the August 13th, 2024 Homes Committee of Management agenda be approved as presented.
We have a mover and seconder, please. Counselor Widner, Counselor Latham. All in favor? That's carried. Thank you. Adoption of the minutes.
Resolved that the minutes of the meeting held on June 25th, 2024 be adopted.
Everyone's had opportunity to peruse those minutes. Counselor Hentz, you're willing to move? Counselor Crooked will second. All in favor? Okay, that's carried. We'll remind the committee members of any disclosures of pecuniary interest in the general nature thereof. Seeing no disclosures. There are no delegations today. We are moving on to section 6, reports and briefings. 6.1 from the Director of Homes and Senior Services, Homes Committee of Management. Long-term care director's update from April 1st, 2024 to June 30th, 2024. Good morning again, Michelle.
Good morning, and thank you, Mr. Chair, through you to the members of Committee of Management. So this report provides an overview of recent updates and Ontario Health and Ministry of Long-Term Care announcements impacting our 3 homes and an overview of projects. So we'll walk through the report together. The first section speaks to ministry updates. So on April 19th, there was communication from the Ministry of Long-Term Care releasing a memo outlining a COVID-19 spring vaccine campaign, and that was based on waning immunity within the community as well as residents in long-term care, and focusing on prioritizing their higher risk individuals, which are certainly individuals 65 and over. So the vaccine campaign was put into place in each of our 3 homes. The IPAC managers worked with Southwestern Public Health to make arrangements and ensure that the vaccinations that were eligible. So there is a 6-month time frame in between shots or between vaccinations. And also if you have a COVID infection, you have to wait 6 months after the infection. So that did impact our vaccination rates because admissions coming into the home may have had vaccinations at different times. So it's a lot of tracking, but those that were eligible and consented received. There were also some updates to our COVID-19 guidance at that time. Some items were revoked, but it may be helpful for you to know just what's still in place. So we're still required to do an assessment before we have interaction with residents to determine if we need to wear a mask. Of course, hand washing is still a top priority. We're still screening our residents for signs and symptoms every day, and still doing education and audits. So those pieces are still in place. And a communication did go out to residents, families, and caregivers, reminding them of the importance of vaccination, as well as the Paxlovid therapeutic that's available should they become ill with symptoms of COVID. On April 26th, the ministry sent out some updates that were related to Ontario Regulation 246/22 that came into effect in May and July. So I've outlined the updates for May for you. There were staffing qualifications, which were really focused on supporting recruitment and retention and providing flexibility. I'll give you one example. So the administrator requirements have changed such that you no longer have to take the administrator course prior to becoming an administrator. You could take that within 24 months timeframe if you have some experience, relevant experience. So those are some examples of some of the changes. Another change was the skin assessments that are typically only been done by registered nurses and registered practical nurses can now be done by nursing student externs as well as other regulated health professionals. And then the air conditioning changes, they've updated the regulations to align with if a resident does not want air conditioning in their room, and just reinforcing the heat related illness prevention and management plan. And for July, there were some changes again as well. This was related to nursing students being able to administer medication and conduct skin assessments. So historically, we've been allowed to have that occur during a clinical placement, but now we could technically hire nursing student externs, and they could do those 2 pieces, but they would have to do so with direct registered staff supervision. So some challenges around sort of managing that piece. And RPNs are now allowed to complete assessments to determine eligibility for long-term care. They were allowed to do that prior, but now they can sign for that as well. And then some clarification on access for essential visitors during emergency situations. They made some changes to pandemic provisions for those that are on a wait list for long-term care. So during the height of the pandemic, if you had a bed offer and you were on the wait list, you could refuse the bed and still remain on the wait list. Because we were in the height of the pandemic, that's no longer an option. So that's an example there. On May 1st, just moving through the document, the ministry also released a memo around the consultation on the Ontario's regulatory registry and staffing qualification flexibilities for PSWs. We did take advantage during the height of the pandemic to hire PSWs that hadn't received their certification yet. So that provision is still in place, that if you feel, if the licensee assesses the qualifications and determines that they can meet those standards of care, you could still do that until July 1st, 2025. And then in regards to the Health and Supportive Care Providers Oversight Authority Act, it is now final. And a press release occurred on June 4th announcing that beginning December 1st of 2024, the more than 100,000 personal support workers in Ontario will have the option to register for this HSCPOA. It's not mandatory. There's no cost for them to register, but the value in registering is that then they are listed on the online public register. They would be easily identified by a badge or a certificate for showing proof of registration. Similar to the College of Nurses, but certainly not to the degree of the College of Nurses. It's not mandatory, but there is also a complaints process available, a dispute resolution process available, and an investigation process available. So once there's a couple of informational webinars happening in July and August. Once we have more information, we'll be able to share that with frontline staff so that they're aware that they have the option at that time to register in December. On June 6th, there was a press release announcing the new Minister of Long-Term Care. So Natalia Kusendova-Bashta is the new Minister of Long-Term Care. She is a registered nurse by background and also worked in the long-term care sector during the height of the pandemic. And being an Advantage Ontario board member, Advantage Ontario has already connected with the new minister and is setting up meetings to build that relationship. The Canadian Association for Long-Term Care advocated for a national day to be established to recognize long-term care in Canada. And so that date is June 13th. And it's an opportunity to acknowledge the collective contributions and achievements of the sector and to recognize and celebrate the residents that do live in our homes and the hardworking staff who provide care to those residents. On June 18th, another reminder again came out because for air conditioning, because of the unseasonably high temperatures during June. I won't go through those because they're not new to us. They've been shared prior. On June 24th, as part of the new Your Health, a plan for connected and convenient care launch and the Convenient Care at Home Act, it was announced by Deputy Minister Melissa Thompson that the 14 LHINs that were operating as home and community care support services are now amalgamated into a new service organization called Ontario Health at Home, and that was effective June 28th. At this time, they're in the transition period, so there's no changes to the long-term care placement process for our homes or for families or for caregivers. Applicants will still continue to move through the same process. But looking forward, the ministry is wanting to bring the partners together and consider how placement services could be managed in the future and on a more longer term process. They will also be considering the role of the Ontario Health teams into that, in providing integrated service delivery for that piece. The next section of my report is the Ministry of Long-Term Care and Ontario Health West reporting. So mentioned at the last report, we continue to have weekly, quarterly, annual, and other time-sensitive reporting and document execution, submission obligations. And so I've outlined the reports and submissions in this section. So again, weekly bed vacancy reporting, quarterly staffing reports, Schedule F for the declaration of compliance for our adult day programs, signing and submitting for the level of care funding increases for both long-term care and the base funding for adult day. And did have to sign for the notice and amendment for our long-term care service accountability agreement, which was the respite beds being renewed, 1 bed for each of our 3 homes. So that occurred. And there's surveys that have to be completed annually. So the French language service survey was completed for all 3 of our homes and adult day program in June, as was the Advancing Indigenous Health Strategies and the Health Equity Plan survey. There were also 4 agreements executed during this time frame. One was for the hair services at Elgin Manor and Beaubeer Villa. This is a service that residents pay for their individual hair care services. There was a modest price increase for this 1-year extension. An exciting piece is that we now have social worker services available in our 3 homes. We've done several RFPs over the years and we were quite successful with this one. So we have an agreement in place with AgeWise Solutions. And the funding for this comes through the resident health and wellbeing funding, as well as the allied health professional funding. So we have 2 days a week at Terrace Lodge in Elgin Manor and 1 day a week at Beaubeer Villa. So supporting residents and families through the admission process, that transition piece, emotional wellbeing support, if there's some family dynamics or maybe consent and capacity challenges or financial challenges, those are pieces that are beneficial. There was also the preventative maintenance program for mobility devices, and that agreement was signed on May 10th with Wellness and Mobility. And also Eastlink Business, cable services for Terrace Lodge and Elgin Manor. So a 3-year term was signed for that. There was no price increase for the residents, which was good news for them, and they got more channels. So that was excellent. As also, there was no fee for our Terrace Lodge residents if they had to move as part of phase 2. So they didn't charge for relocation of the phones. So that was great. Some of the project updates, eConnect, I spoke about that. I won't go into great detail, but that project is quite an extensive one. So we're still onboarding individuals to provide them access. That's for regulated health providers. Staff schedule care, the project sign off has been completed by myself and the Director of Finance. So mass messaging has been implemented across all 3 of our homes. The administrative clerks utilize that for future calls and positive feedback from that feature. And the registered staff use what's called the Wizard for same day after hour calls. And we do have some new or returning managers and onboarding of new staff. So that's being supported by current team members. And there are resources within the staff schedule care system. And we do have some remaining blocks of time that we previously purchased. There were 3 policy updates during this quarter, and they're listed there for you. Code Silver was updated from person with a weapon to include also a threat of a weapon. And an updated checklist was developed. The medication self-administration policy was updated to align with requests from our proactive compliance inspection at Beaubeer Villa and had an interdisciplinary approach to updating that policy. And based on the spring COVID vaccine campaign, there was updates to the medical directive to align with current recommendations. Financial implications. So on May 6th, I'm excited to share that we received our case mix index funding report. And so the provincial average for the CMI, we call it, which is case mix index. I'll just back it up a little bit. So all of that funding is based on all the coding and assessments that we conduct and are submitted to CIHI, Canadian Institution for Health Information. The ministry then develops what's called a reindexing factor, and then we get our scores. So the provincial average is 1.02, and all 3 of our homes are well above the provincial average. We're actually in the top 10% of the province. So we're doing well. I've outlined the budgetary impacts. So Beaubeer Villa saw an increase. Elgin Manor did a bit of a dip there, but still well above the provincial average. And Terrace Lodge went down ever so slightly, but because of the reindexing factor, there's still a positive $5,000 there. So overall, across the 3 homes, just a negative impact of $19,000, just under $20,000. We also received the level of care funding summary at the same time on May 6th, and that's a 6.6% funding increase. We have conducted a preliminary analysis, and I did promise a funding report. However, we're still awaiting arbitration outcome results, and so I don't want to bring information without having that information to feed into the report. So that'll be forthcoming. On May 3rd, we also received communication from the ministry about the annual increase for accommodation rates for our residents for basic, semi-private, and private room rates. That there's a cap of 2.5% increase. It is based on the CPI, which was 3.9, but the cap is 2.5. So I've outlined the new rates as effective July 1st. And just to give you an example, the basic rate in June of this year was $65.32 per day. It's now $66.95 per day. And the communication did go out to all the residents and families within the required timeline of communication. Another good news, on May 14th, we received, we've been involved with what's called the PREP program, Preceptor Resource and Education Program for Long-Term Care, to support our clinical placements. And we've had funding the last 3 years. We weren't sure if they were continuing the program. They've announced they are, so we've submitted our applications and registered for this coming year. On May 17th, there was a communication. It didn't impact our homes, but there was a communication regarding fraudulent police record checks and TB screening documents related to security and resident support staff through a contracted agency. So the ministry did contact the homes that were utilizing that one. We did use agency staff in the height of the pandemic for a very brief period of time, but we haven't utilized them for a few years now. So we have a very diligent process working with Human Resources to make sure all of the screening is completed as required. On May 23rd, the ministry released a memo advising of a mandatory survey to obtain information on how we're spending our minor capital funds in past years and what our plans are for future years for project. The survey was completed by myself, the administrators, the finance department, and the facilities department. There's 3 fundings that make up this funding. So there's the falls prevention, the IPAC minor capital, and the long-term care minor capital. So we're waiting to see the analysis of that survey. We haven't received communication yet for this year's minor capital funding, but hopefully we'll see an increase there as well. On June 3rd, there was an announcement of increases to the laboratory services funding guidelines. And so that was retro back to April 1st. So we have weekly lab services. All those costs are covered through this funding. On June 18, the ministry released a one-time funding integrated technology solution program. It's not a new funding. What they did is they took the medication safety technology program funding and the clinical support tool funding and combined those two. We actually are in the chart there. You'll see we got a slight decrease at 2 of our homes, and 1 of our homes did receive a slight increase. Those changes are manageable, and we'll continue with the work that we're doing through that initiative. There was also a memo release with the change in the IPAC personnel and training and education funding. That did result in a fairly significant decrease for our 3 homes, but there is flexibility within the allied health professional funding that we receive. So we'll be able to utilize that to make any adjustments for those decreases. We also have education funds through some of our providers, so we could maybe shift some of those costs there if needed, but I think we're in good shape. The announcements from the Ministry of Long-Term Care and the Ontario Health Support, Ontario Health Support the quality of care and positive outcomes for our 3 homes as we continue to provide care and services to our residents. And so we're just really thankful for the ongoing support of council and our CEO and senior leadership across our 3 homes. And so just asking that the report be received and filed, and I'm happy to answer any questions you may have.
Thank you, Michelle. That's a lot of material to digest. Does anyone have any questions? Councillor Cockett.
Thank you, Mr. Warden, through you to Michelle. 2 questions, if I may. Do you have a case mix index for dummies, so I can understand what that is.
Hmm.
The second question deals with the cost of the rooms, the basic rooms, I take it, are the ward rooms, which we have very few of. How do you determine the cost for a room? Because we do get, grants from the province and from the county, and so how do you determine the cost per room? Thank you.
Great questions. And so your first question, the case mix index. In the funding report, that's probably a good opportunity for me to elaborate further on the process for that. It is rather complicated, but high level, it's all of the coding and assessments that we complete are sent to High. They do what's RUG weighted patient day analysis, and then they look at the entire province. They have one piece of pie, and that's where the reindexing factor comes into place. There is a 5% min max, so a home can't lose more than 5% of their funding or gain more than 5% of their funding. So, but I'm happy to elaborate further on that process when I do bring the funding report forward or through the budgetary process meetings as well. And then in regards to the accommodations and how do we determine that? So we are mandated to have a minimum of 60% basic bed rates. And then the other 40% can be preferred. So semi-private and a combination of semi-private and private. So over the years, Terrace Lodge was a good example because we had a lot of double rooms that were basic, but with having to have a 60%, some of the, I'll use Terrace Lodge as an example. Again, we have 4 different sizes of rooms at Terrace Lodge. So those smaller rooms that are further away from the more common areas will be designated as our basic rate rooms. And then we won't be having semi-private rooms at the end of the project of Terrace Lodge. There'll be 60 basic and 40 private. The other 2 homes have basic, semi-private, and private. Hopefully that answers your question. And the pricing is actually determined by the ministry. So they send that out to us annually. It's communicated to the finance department for billing purposes and to residents and families.
Yeah, if I may, so to be clear, the cost of the rooms, as you finish saying, it is determined by the ministry, period. You have no say in terms of what you charge. Okay, then.
Well, I think just to be clear, it's what you can charge back for the room. It's not the cost of the room, which gets back to what Councillor Sloan's getting at earlier. Yeah. Okay. Any additional questions? Councillor Woodner.
Yes, thank you, Mr. Warden, through to Michelle. Like, I think at page 18, there's a category called abuse and neglect, and I've read it. Can you quickly explain, in your words, how that works? There's 28 cases in the 3 homes, but is that them abusing each other?
Are we on to the next report?
Oh, I'm sorry.
Yeah. Hold on to that one.
I will. I got
Okay.
you.
Any other questions regarding the first report? Okay, Catherine, please.
Resolved that the report titled Homes Committee of Management Long-Term Care Directors Update, April 1st, 2024 to June 30th, 2024, from the Director of Homes and Senior Services dated August 13th, 2024, be received and filed.
We have a mover and seconder for that. Councillor Cookett, Deputy Warden Jones, all in favor? That's carried. Moving on then to 6.2 from the Director of Homes and Senior Services, Homes Committee of Management Long-Term Care Operational Report.
Thank you. So this report focuses more on the day-to-day operations as well as our inspection reports and just pertinent departmental and committee updates. So we'll walk through the report together. The first section speaks to the Ministry of Long-Term Care Compliance Inspection Visit Report Summary. So just a reminder, I mentioned last time that inspections are unannounced. They can last anywhere from a day or 2 up to 2 weeks. And there are 3 types of inspections. The first one is a reactive inspection when we submit a critical incident, which we'll speak to, or when we receive a complaint, or sorry, the ministry receives a complaint. And then a proactive inspection is a regular basis inspection annually to ensure home is in ongoing compliance with the act and the regulation. And then Terrace Lodge is experiencing the third type, which is the pre-occupancy and post-occupancy inspections as we go through our redevelopment project. So Beaubier Villa did have one inspection this quarter. It was in the month of April. They were on site for 5 days to conduct a critical incident inspection related to an allegation of resident abuse. There were no findings related to resident abuse. There was one written notification issued related to falls prevention and management and skin and wound care in relation to the assessment piece. And so we've had a lot of follow-up discussion as a team in regards to the written notification. This isn't new. Long-term care homes do receive this one if an assessment is missed. There is clinical support tools that we've been utilizing for a period of time, but RNAO that we've been working through the Best Practice Spotlight Organization project has developed clinical pathways that are evidence-based. A lot of homes are moving towards these support tools, which includes the assessments and finding more positive outcomes. So we have also just moved towards that project, and we'll be doing our training in September with full implementation in January or February of 2025. So looking forward to not seeing this type of written notification in future inspections once we get that new program up and running. Elgin Manor also had one inspection in the month of June. They were on site for 7 days, and that was in response to 6 critical incidents that we had submitted in regards to resident abuse and fall. There was one compliance order, and it was in regards to post-fall procedures and a process to follow when residents' status changes, again, related to assessment. And just the order was requiring us to do additional training. And so that was all completed within the required timelines. The home management team took this one very, very seriously and continued to audit very closely. Again, this is part of the conversation about switching to the clinical pathways with RNEO. Terrace Lodge had 3 inspections during this timeframe. The first was our pre-occupancy inspection in April for phase 2. There were 7 minor deficiencies identified. 5 of those were construction related and 2 were operational, which just needed to be completed on the day of move. So making sure their equipment moved with them and making sure that memory care resident home area secure door was relocated. And then on May 28th and 29th, the ministry was back to Terrace Lodge to conduct a critical inspection related to outbreak and a resident fall. There were no findings of noncompliance for that inspection. At the same time, they did their post-occupancy inspection for phase 2 move, and there was also no findings of noncompliance. The next section is the critical incident summary for our 3 homes. So I have outlined for the period of April 1 to June 30th, the total number for all 3 of our homes. And so we've listed them there. Each of the 3 homes, just a reminder that the abuse and neglect critical incident report includes harm or risk of harm. So we do have our 3 memory care resident home areas with residents that have mild to significant cognitive impairment. And despite interventions, they'll sometimes get into each other's personal space, and there's that risk of harm. So we are very diligent in our homes of reporting that to the ministry. And so 25 of those 28 reports were specific to those types of scenarios. And then our BSO teams, Behavioral Support Ontario teams, we have an internal team and an external team. They work very closely with our home staff to continue to develop additional interventions to support residents in those areas. And it's also, I didn't share earlier, but our social work service agreement, they also are Behavioral Support Ontario trained. And so they're an additional sort of third support for our homes. So we're looking forward to engaging them. They've just started in our homes in July. So we'll look forward to engaging them into these types of situations for additional support. And hopefully those numbers will see a decrease in future reports. The 3 written complaints that we received during this quarter was one was related to entry to the home. A second was related to temperatures of the home. And a third was related to communications related to dietary intake. And appropriate follow-up was completed for all of those. And through our CQI process, the management team and the CQI team does look at all of these critical incidents and do an analysis and a review to see if there's any additional training, policy updates, or education that's required. For outbreaks, it was a busy quarter. Similar to 2023, there was a lot of activity and outbreaks across the province during this time frame, and we're seeing it again, not only in our homes, but across the province. So Beaubeer Villa, again, very fortunate, no outbreaks, but Elgin Manor did have 4 outbreaks. If you look at the right-hand column, you'll see that the first 3 outbreaks, minimal number of residents were impacted, but with the COVID outbreak, 22 were impacted. And at Terrace Lodge, there was 1 outbreak and 24 were impacted by the COVID outbreak. And these numbers are similar from what we're seeing across the province. And the fact that we were having outbreaks then again impacts our ability to vaccinate residents. And so it kind of has that cyclic cycle there, but we are approaching our fall campaign for COVID and influenza vaccination. So we're starting to have those conversations and awaiting information from public health as to when vaccines will be available. The next section is occupancy data. Just a reminder that we do require a 97% occupancy for full funding, and we were able to maintain that over the last quarter. All of the statistics are there for you. You can see, I'll just point out Elgin Manor as an example, had 15 discharges and 13 admissions during that time frame. Health system partners, so we continue our monthly fire drills on all shifts and our monthly health and safety inspections. Southwestern Public Health was at Terrace Lodge before our phase 2 move to do an inspection of the dining rooms and the home kitchens and serveries, and there were no findings of compliance. Elgin Manor did receive a field or site visit from the Ministry of Labor, Immigration, Training and Skills Development in April. It was in relation to a complaint regarding a verbal threat of violence. Through their inspection, 2 orders were issued requiring us to do a very minor policy update and to complete a risk assessment and training. So just for your awareness, we do the annual risk assessment. It had been completed in November of 2023, but the expectation is that we do it immediately after this type of incident. So a debrief was done, but that wasn't sufficient for the regulations. So that was completed after the inspection. I won't go through these in detail, but I've just provided some departmental updates. There's lots of activity going on with barbecues and making sure. I will share, Beaubeer Villa did a theme event of a pasta bar, which was an omelet style pasta bar. They could pick their pasta, pick their sauce, pick their toppings, and it was such a hit that they requested to have it again in June. So that was a great event that they held. Some other highlights just to maybe mention. The solar eclipse was a good event at all 3 of our homes, and there was big celebrations, of course, for Mother's Day and Father's Day and Canada Day. I will comment that the Summer Reading Club intergenerational program partnership with Elmer Library is a good success at Terrace Lodge as well. They've also had out trips to the Imperial Market for a coffee out trip, and they've been involved in an art therapy project, and that photo was included in the package. And so we're just waiting for the plaque, and the title is Home is Where the Heart Is. Terrace Lodge also participated in East Elgin Secondary School Community Volunteer Fair. And all 3 of our homes are really seeing an increase in uptake in active volunteers. So each Beaubeer and Elgin Manor both had 2 new volunteers this last quarter, and Terrace Lodge had 19. So they're up to 50 volunteers there, and they're introducing some new volunteer positions. So horticulture, gift shop, because Terrace Lodge will now have a gift shop, and some recreation program support. From the nursing department, so Beverly Drulard, who was a registered nurse at Beaubeer Villa and then moved into our quality improvement role, has now accepted the manager of resident care position. So she's very well suited to support Beaubeer Villa. And we filled that quality improvement role as well. Terrace Lodge has done an implementation of trialing bath shifts, which is being very well received by staff and by residents And so positive feedback on that. Summer students are in place across all three of our homes, and Elgin Manor has had PSW and RPN clinical placements. The next section is quality indicators. So in the last report, I provided copies of our quality improvement plans that were submitted to Health Quality Ontario. The 4 indicators that I've included in this report do form part of our QIP, our quality improvement plan. Again, all the data comes from resident assessments and coding. And so that's done on admission, readmission, quarterly, whenever there's a significant change in status, after every fall, and weekly for wound assessments. Again, that data goes to CIHI, and then we get our results, our percentage results through CIHI. So every resident is part of the analysis every quarter. And often you'll see that we have actually more residents than our total bed count. So for example, 90 beds at Elgin Manor, but we had 13 admissions the last quarter. So 103 residents potentially were part of that percentage qualifier. Our homes also have mandatory programs and multidisciplinary committees for each of these 4 indicators. And we've implemented best practice guidelines on falls, restraints, and wounds with RNAO. When you look at falls, the percentage of falls for the quarter includes all falls, so whether there was an injury or not. So that's an important piece to remember. And when we look at each of the indicators, I'll touch on them all very briefly, but there are variables that will impact this every quarter. So when we look at falls, does the resident diagnosis and history on admission has an impact to falls? So somebody with Parkinson's that has the shakiness or the stiffness are a higher risk fall. Somebody with dementia who, despite us putting the walker right in front of them or beside them or cueing them to remember to use your walker when you get up, is apt to not remember to do that and apt not to remember to ring the call bell. And then we do have frequent fallers. So when you look at the percentage, I'll use Elgin Manor for an example. So for January to March, they had a 12.6% fall rate. In January, there was actually 20 falls, but only 11 people were involved in those falls. So we do have frequent fallers that will increase those statistics. So that's consistent across all 3 of our homes. And so there you'll see peaks and valleys of those statistics. If you look at Terrace Lodge, who had 24.4% in April to June, we had a move in June. And so we all know when we move to a new room, despite having a night light on, that getting up in the night, we think we're getting up on the correct side of the bed, but it's actually, we should have gotten up on the other side of the bed. So all of those pieces play a role in that. And I'll just take you back to the critical instance submissions. There was only 3 falls that were submitted to the ministry where residents were transferred to hospital for assessment. So although falls are happening, we're working diligently to try and support the falls prevention process, but we will continue to have falls. And then there's, of course, there's like a significant follow-up that's done when a resident falls. They're assessed by nursing, by physio, by physician, by pharmacy, looking at medications and drilling down on the time of day. Do we need to implement a toileting routine and actually come in and wake you up at night and take you to the washroom so you don't get up on your own between rounds, those types of things. The next indicator that I've included is daily physical restraints. And so a physical restraint is defined as any method or piece of equipment that's either attached or adjacent to a person that they cannot remove easily. In our homes, there's only 2 physical restraints that are permitted, and that is a seat belt that you can't undo or a tabletop that you can't remove. Those pieces of equipment could also be seen as a personal assistance service device. So we may put a tabletop in place when you go to meals because it helps keep you in a more upright position, and or even for snacks, it allows you to have to be able to reach them, or for reading, or if you're doing some coloring or something. So we would put those on just for that time frame, and then we would remove it. So we've done a lot of work across our 3 homes. You can see our numbers are either 0 to 2%, and so that's an excellent outcome at our homes, and that's through 2 pieces. We're doing a lot of education with residents, staff, and family members. Because when people fall, the first instinct is we better put them in a chair and put a seatbelt on them. So residents, families are very fearful of their loved one having a fall. So there is a lot of education on the risks and benefits of physical restraints and putting some additional interventions such as a falls mat or a chair alarm or a bed alarm in place. So hopefully that's some additional helpful information for you. The other piece that we're doing work on is we're actually looking, when we're looking at our placement applications and we're seeing that there's physical restraint in place, we're actually picking up the phone and having a conversation with the hospital to say, you know, what can we do in advance of them coming to our home to remove that device? And so those are some of the pieces that we're working on. For worsening pressure ulcers, you'll see some varying rates there. A pressure ulcer is a lesion which is caused by unrelieved pressure that results in damage to the tissue. So that happens when sometimes it's residents that are coming into our home with pressure ulcer, or that are coming back to us from readmission. Some residents' diagnosis predispose them to pressure ulcers, so diabetes, even dementia residents, as their disease progression, their swallowing changes, their nutritional status is a big piece of wound healing. So those are some of the factors that play a role in our statistics, but we do again have the team and we're doing weekly assessments and putting interventions into place. And the final indicator that I've included there is antipsychotics without a supporting diagnosis. So really that's what that means is the use of chemical restraints. So it's a medication that's given with the specific and sole purpose of inhibiting a specific behavior or movement. So if we're using the medication as a therapeutic agent, such as for a clear-cut psychiatric or medical diagnosis, is not considered in this category. Outside of that, it would fall into this category. So again, a lot of residents come to us on these medications, and so it does take a period of time to evaluate the resident and do some trials, see if we can reduce that medication, what impact does it have. And sometimes we will make adjustments and we know that it's not in the best interest of the resident and we do have to resume that medication. And you'll see some big changes for Beaubien Villa and Terrace Lodge here. And that's really, we had a new pharmacy service provider that came on board and really is doing some great work evaluating medications, medication history. And the piece that impacts this indicator as well is all the coding. So if whoever's doing the coding misses putting in a diagnosis, it's going to increase our numbers. And so that's what's happening at one of our homes. And so we've got some work to do there just to make sure we're capturing the great work that we're doing, right? And that all those pieces are available. So that's quality indicators. And then the administrative department updates are included here. I've already spoken to staff schedule care and clinical connect. I've listed there's quite a bit of education that the management team has been doing with CMHA, and the manager is a coach learning session. And 3 of us did attend the severe weather reducing risks and safeguarding communities. And phase 2, that's the big news. Phase 2 of Terrace Lodge is complete. Again, information is communicated as appropriate to departments and resident family council staff and visitors. And that concludes my report, and I'm happy to answer any questions you may have.
Thank you very much for that report, Michelle. Any questions? Councillor Whitner, has your question been answered or?
Well, one of them's been answered by this excellent report, and I thank you for that. One that I'm just curious about, slips and falls at Terrace Lodge. It's not related to the new bi-level flooring system we had developed, is it? Thank you.
Okay, thank you for that. Any additional questions? Okay, seeing none. Catherine?
Resolved that the report titled Homes Committee of Management Long-Term Care Operational Report from the Director of Homes and Senior Services dated August 13th, 2024 be received and filed.
We have a mover and seconder for that. Councillor Whitner and Councillor Latham, all in favor? That's carried. Thank you. I see nothing further on the agenda. Do we have a date for the next Home Committee of Management? Apparently that will work. All right, which brings us to the adjournment motion.
Resolved that we do now adjourn at 12:09 PM to meet again at the call of the chair.
Do we have a mover and seconder for that? Counselor Whitner? Counselor Jiguer? All in favor? And that is carried. Thank you very much for attending.